Hi everybody, Dr. Britt Talley Daniel MD, neurologist and a headache doctor. And today I'm YouTubing on the subject of how much caffeine is too much. Well, a discussion about caffeine is common for neurologists and headache doctors because many times the patient you're going to see comes into the office complaining of severe daily headaches with migraine features, but carefully cradling in his or her hands a grande 16-ounce Starbucks latte, which has 550 milligrams of caffeine in it. And neurologists and headache doctors are called to educate and recommend decaffeination to many patients, particularly migraine patients, on a daily basis. So the question is, how much caffeine is too much? Standard dietary guidelines suggest adults without migraine may consume up to 400 milligrams of caffeine a day as the maximum dose can be taken without affecting their general health. This is equivalent to around 3 to 5 8-ounce cups of coffee a day. Advice here should balance between persons with migraine and those without migraine. Migraineurs, that is, patients with migraine, should only take a small amount of caffeine or no caffeine. And a lot of folks don't know they have migraine, but they do when you interview them. Adolescents shouldn't take more than 100 milligrams of caffeine per day. Pregnant women should limit the daily intake of caffeine to less than 200 milligrams of caffeine a day. And the effects of caffeine on a baby are really not well known. What constitutes a safe amount of caffeine differs from everyone based on their age, their weight, their overall general health, and whether or not they inherited the migraine gene. Persons taking more caffeine may suffer from caffeine overuse. Now, oftentimes, this same patient may be taking also several Excedrin migraine tablets a day, and those tablets each have 65 milligrams of caffeine in them. And a doctor should do an accurate caffeine count for every headache patient when he sees them. The American Migraine Society articles have stated that caffeine is the #1 drug in America that causes medication-induced headache, which is the diagnosis in 80 to 90% of new patients for a headache clinic. Related questions. Well, what's the usual source of caffeine? You know, you get it from colas and coffee, and I have a big list on my webpage on this at drmigraine.com, and you can visit that and see it. Examples here would be what I started out with, which is the 16-ounce Starbucks latte has 550 milligrams of caffeine. A Dr. Pepper 12 ounces still has 39 milligrams. What are the other sources of caffeine? Well, caffeinated drinks such as coffee, tea, cola, chocolate, food, candies, and energy drinks. Workout supplements for enhancing exercise performance. Cold and flu tablets. Caffeine supplements in tablet or powder form. And these forms often have more caffeine than coffee, and people can find it hard to measure how much they have from looking at this because they don't tell you how much is in it. Caffeine powder itself can contain between 3,200 and 6,400 milligrams of caffeine per teaspoon. And the FDA warns against the use of these products to their potential to cause very serious health consequences. And I'm going to talk about a case about that at the end of this talk. Caffeine occurs naturally in plants, nuts, and seeds, and its manufacturers sometimes add it to food and drinks. Caffeine is the bitter substance. Consider how black coffee tastes. If you don't put cream and sugar in it, it's bitter. And it occurs in more than 60 plants, including coffee beans, tea leaves, cola nuts, which are usually the source of Coca-Cola caffeine, and cacao pads, which are usually make chocolate out of it. Synthetic caffeine, which may be added to medicines, foods, and drinks. For example, some pain relievers, cold medicine, and over-the-counter medicines for alertness contain synthetic caffeine. So do energy drinks and energy-boosting gums and snacks. Caffeine is ubiquitous. It's everywhere. So the question comes up, is caffeine a drug? Well, the current edition of the Diagnostic and Statistical Manual for Psychiatry Diagnosis, the DSM-5, dated in 2017, added a new drug to the list of known addictive drugs, caffeine in amounts as small as 120 milligrams a day. What are the criteria for caffeine withdrawal? Prolonged daily use of caffeine with abrupt cessation or reduction of total caffeine use, closely followed by headache or one of the following symptoms. The patient may have fatigue, drowsiness, anxiety, depression, nausea, vomiting, clinically significant distress, or impairment in social, occupational, or other important areas of functioning. Caffeine may affect the body at a rate of 15 milligrams per liter, that is milligrams per liter, in the blood. A concentration of 80 to 100 milligrams can be fatal, caffeine in the blood. What's a caffeine overdose? The diagnostic criteria for caffeine intoxication or overdose are recent consumption of caffeine in excess of 250 milligrams a day and the development of 5 or more of the following signs during or shortly after caffeine use: restlessness, nervousness, excitement, insomnia, a flushed face, diuresis, GI disturbance, muscle twitching, rambling flow of thought and speech, tachycardia or cardiac arrhythmias, periods of inexhaustibility that is never slow down, or psychomotor agitation. Caffeine overdose is more likely from taking a dietary supplement than by drinking coffee. What is the pharmacology of caffeine? Caffeine acts as a central nervous system stimulator, a point that's made well by the coffee ads on TV where they call it the think drink. Caffeine increases some of the body's process. With caffeine consumption's message moving between the brain and the body can travel faster. And that's one of the reasons why a person may feel more alert or focused after consuming caffeine. Caffeine acts as an appetite suppressant. The duration effect of caffeine is 68 hours, but even one drink in the morning will interrupt nighttime sleep in some persons. Caffeine also acts as a constrictor of smooth muscle, which is found in arteries, the bladder, and the colon. It's the arterial vasoconstrictive action which helps with mild migraine, using like Excedrin, Vivactin, BC powder, and stuff like that, and may lead to the rebound vasodilating headache, which when one withdraws off of caffeine. The smooth muscle effect also acts as a mild stimulant on the bladder, for urination, and on the colon to reduce the bowel movement. Symptoms of caffeine overuse are dizziness, diarrhea, increased thirst, insomnia, headache, fever, irritability, trouble breathing. There's some very serious symptoms of satellite overuse, or caffeine overuse, and those are trouble breathing, vomiting, hallucinations, confusion, chest pain, irregular fast heartbeat, uncontrollable muscle movements, convulsions. Medical problems may be aggravated by caffeine overuse, such as generalized anxiety disorder, insomnia, panic attack or panic disorder, gastroesophageal reflux disorder, migraine, medication-induced headache, epilepsy, death rarely. Who should avoid or limit caffeine? Well, pregnant women, since caffeine passes through the placenta to the baby, breastfeeding mothers, a small amount of caffeine goes to the baby, persons with sleep disorders and insomnia, migraine or chronic headache patients, patients with anxiety, patients with GERD, patients with fast or irregular heartbeats, patients who have high blood pressure, patients who take certain medications or supplements, including stimulants, certain antibiotics, asthma medications, and heart medications. Children or teenagers are very sensitive to caffeine. What about the treatment of caffeine overdose? Advice regarding accidental poisoning is available from Poison Control, a not-for-profit organization which is online or available for chat. You have to call them at 1-800-222-1222 or get help online at www.poison.org. So in medicine, these patients should have sequential blood caffeine levels to follow the course of treatment. The doctor should use activated charcoal, which is commonly given in the ER for drug overdoses, and which prevents caffeine from being absorbed in the stomach and the GI tract. You can give Ipecac, which causes vomiting and elimination of caffeine from the body. Sometimes the doctor will use gastric lavage, to wash out your stomach by putting down a GI tube and washing the caffeine out of the stomach. You can use a beta blocker drug treatment for cardiac arrhythmias and hypertension. Monitor the blood pressure, the pulse, and EKG while you're in the emergency room. What's the frequency of caffeine overdose? In 2016, Poison Control Centers in the U.S. had 3,702 caffeine-related exposures in children and adults. 846 of these cases required treatment at a medical facility, and there were 16 major outcomes from caffeine overdose. Several caffeine-related deaths have been reported. Caffeine overdose is most likely the result of taking a dietary supplement of caffeine tablets rather than from drinking coffee, especially when people combine these products with energy drinks, sodas, or coffee. Supplements increase the risk due to higher levels of caffeine than foods and drinks. Unlike drinking coffee, even take supplements containing caffeine. Using purified caffeine powder is highly dangerous and much more likely to cause an overdose. The United States FDA organization warns that a teaspoon of powdered caffeine can be the equivalent of 28 cups of coffee. It stresses that pure and highly concentrated caffeine products can have serious health consequences. The cause of death from caffeine overdose is typically ventricular fibrillation, and this condition happens when the lower chambers of the heart vibrate rather than contracting normally. Ventricular fibrillation stops the heart from beating normally and causes cardiac arrest. The fetus or newborn is unable to break down caffeine quickly. The American College of OB-GYN advised women who are pregnant to limit their caffeine consumption to less than 200 milligrams a day, which is equivalent to 1 to 2 cups of coffee. For women who are breastfeeding, the Centers for Disease Control and Prevention, the CDC, states that a low to moderate intake of caffeine should not affect a baby. The impact caffeine and stimulants on children and adolescents is uncertain, and is the reason why the American Academy of Pediatrics has stated that children and adolescents should not consume caffeine. Toxicokinetics. Caffeine is rapidly and nearly completely, up to 90%, absorbed by the stomach, with peak plasma concentrations occurring within 20 to 40 minutes. Toxic levels can be reached quickly and last for prolonged periods of time, secondary to caffeine's 3 to 10 hour half-life. The liver metabolizes caffeine via N-demethylation, acetylation, and oxidation. Other substances that use these same pathways, such as alcohol or medications, can prolong the half-life of caffeine by approximately 72%. So I came across this article about a man dies of caffeine overdose, a case history in News Corps, published October 2010. A British man died from poisoning himself with 2 spoonfuls of caffeine powder bought over the internet. This guy was from central England. He was at a party in April when he swallowed caffeine powder that a friend had bought online. There was a coroner's court heard Thursday in Nottingham, England. He washed the powder down with an energy drink, and around 15 minutes later began sweating and vomiting blood. He later died at King's Mill Hospital in Nottingham, central England. The Nottingham Post reported, the court heard that this man ignored the product's recommendation to take no more than 1/16 of a teaspoon, instead took 2 spoonfuls of the powder, and just a level of caffeine 70 times more than usually found in high energy drinks. Speaking outside the court, Bedford's aunt said, I think there should be a warning on it saying it can kill. Nottingham coroner Dr. Nigel Chapman said, caffeine is so freely available on the internet for 3.29 pounds, but it's so lethal if taken in the wrong dose. And here we see the consequence. So many people are upset and distraught by the death of this man. He also criticized the product, which was not named in the inquest, for recommending such a small dosage, which could be easily ignored. Who would take 1/16 of a teaspoon? It's such a small dosage. The warning is so small in the front of it. If you're sharing a bag, carrying it around, and if you hadn't seen the warning, it could be that anyone at the party could have taken it. It's a dangerous thing to have around, something like this. He recorded a verdict of accidental death from caffeine powder. So this is the end of my talk on how much caffeine should one take. It really impacts on migraine patients. Please click down there on subscribe so we can follow each other. Follow me on YouTube for other podcasts and YouTube casts on migraine. God bless all you persons who have migraine, and I will see you on the next talk.